So I want to thank you today for viewing the Strategic Prevention Frameworks Planning webinar by Preferred Family Healthcare Prevention. Um, we're going to be going into this pretty in depth and going to explain a lot of the details to you to help you better understand the planning part of the Strategic Prevention Framework. First thing I want to do is tell you a little bit about myself. My name is Edward Mears. I'm the Prevention Specialist for Service Area 14. I'm a Certified Missouri Advanced Prevention Specialist. I am the Prevention Specialist for Adair, Lewis, Knox, Scotland, Schuyler, Marion, Shelby, Clark, and Macon counties. My primary responsibility as a prevention specialist is to mentor community coalitions in the Strategic Prevention Framework. I worked about 10 years in substance use and mental health disorders, and I think that I can teach you a lot about this today. So some of the objectives we're going to do today is we're going to talk about the reason for planning. We're going to talk a little bit about how your mission fits into the planning phase and how to create effective goals. We're going to use the 7 strategies from CADCA. We're going to learn about interventions, and finally we're going to learn about logic models, which are key to planning. For a little more added information, I've included the CADCA primer on planning in the bottom right hand side of your screen. You can click on that and download that and just have it for anytime you want to read it. It's got a lot of good information in there. A lot of the information in this webinar is pulled from that primer. So I would encourage you to download that and have that. All right, so first thing, what is planning? Planning is a process of developing a logical sequence of strategies and steps leading to community-level alcohol and other drug reduction outcomes that move coalitions closer to achieving their vision for healthier communities. Basically, planning is just very vital. If you don't have a plan, you're not going to succeed very well. We're going to talk about some of the benefits of planning. It helps to ensure the interventions your coalition selects. So when we get towards the end of this, we're going to talk more about interventions, and having a written plan for people to view a hard copy or something that they can see helps to guide them. It gives them a roadmap to success. It can help you to allocate resources that you need for implementation, which saves you money. If you have a plan and you know who's going to take care of certain parts of it, then you don't have to pay for some of these services or pay for some of the products that you need, because you'll have people in place that can help you with that. It also enables your coalition to develop an action plan that describes who is doing what and by when. A lot of times we can tell people to do something and somebody forgets, and they forget, who did we tell? We don't know. Well, when we talk about action plans, they're written and they're assigned to people, and we go back and review them and make sure that that person did well at that. We evaluate that process. If we don't think it worked out very well, maybe the next time we would have someone else do it or look at it differently. And enables your coalition to develop an evaluation plan at the beginning rather than the end of the activity. So if you've got a plan of what's going to happen at your activity or in your strategy, then you already know what you're hoping for, what the outcome will be. So you can go ahead and create that evaluation plan and have that ready rather than scrambling to do that at the end. And one of the more important parts is it helps your coalition secure future funding. Whenever you go to funders or stakeholders and you're asking them, hey, can we have a donation to do this or do that? They like to see a plan. They like to know what you're going to do, that you've thought about it, that there's a step-by-step action plan for it, and it gives them confidence that their money is going to go towards something valuable, or their time, or whatever it is they're helping you with. You can show them, we've got a plan for this, and this is how come we think it will work. Some different reasons to plan is for recruitment of volunteers and stakeholders. Again, you've got that plan, you show it to them, and you show them that you're organized and you know what you're doing, then they're more likely to give you their time or resources. Another reason is interventions. You can look at different interventions for the different issues you're dealing with, and having a plan for that helps. Budgeting, again, it always saves money to have a plan. Another type of plan is coalition leadership. If you can have It already set out for who's leading this and who's leading the coalition, things of that nature. And a big one is it just helps to achieve community level change, which is the ultimate goal. We want to change some of these problems that we have. So where do we start? How do we get this plan rolling? So the first thing we want to do is reduce a problem in your community, right? We want to plan on that. So that's what we're going to talk about today. The plan is to reduce a problem in your community. So let's define a problem. Can't reduce a problem if we don't know what it is and we haven't planned for it, right? So let's find a problem. All right, so how do we define a problem? Well, the first part of this is more of an assessment step. Some of the things you would have gathered during your assessment phase is your population size, the usage data on the different substances being used, maybe the ages of those using. There could be a lot more. You can go as far as gender and ethnicity. You can go with the hot spots in your community. There's a lot of different things, but we're going to keep it somewhat basic for the purpose of the webinar today. So it's important to remember your vision and mission whenever you're planning. You want to make sure that whatever it is you're doing, whatever problem you're looking at, whatever interventions and strategies, that your vision and your mission, that those things all work together. You don't want a mission that goes in one direction and then start planning for something that goes in the opposite direction. You want everything to flow well together. If you have a plan that doesn't fit with your vision or mission, then you need to change either your plan or your vision or mission. So let's define the problem. So when you're defining a problem, when you're looking at the data, some things you want to remember is that you want to identify one issue or problem at a time. We don't want to list a bunch of things in one little spot. We want to think of one solid thing. We want to avoid blame. So we don't want to say young people cause too much trouble or young people are doing this or doing that. We just want to state a problem. We want to avoid naming specific solutions. So something like the problem is we don't have a youth center. Well, that's not a problem. That's a solution to another problem, getting a youth center. We want to define the problem by the behaviors and conditions that affect it. So when we say something like that, we want to talk about things are too hard or they're too this or they're not enough of that, and not just go randomly with it, okay? Ensure that they are specific enough to be measurable. Any good plan has to have a goal at the end, and if it's not measurable, then you have no way of knowing if you affected any change at all. We're going to talk a little more about that. And reflect community concerns. So you want to make sure that your problem reflects what the other people in your community believe. You don't want just one person's opinion as to what the problem is. All right, so we're going to talk about a problem statement. A problem statement is comprised of three parts: your problem, your but why, and your but why here. And we're going to go over each one of these in detail right now. So, an example of a problem, the first part of your problem statement. Too many youth are smoking cigarettes. That's a problem. Youth smoking cigarettes is a problem. And in this community, then there's too many. So it's very right there. I mean, it's exactly what we want to hear. It's not blaming people. We're not blaming the youth for doing something. We're just saying that a lot of them are doing it. Now, what we want to do here is we want to make sure that it's measurable. If we just say too many youth are smoking cigarettes, that's not really measurable. So in order to make this problem statement measurable, we want to add a piece of data to it. So as you can see, right underneath this, in parentheses, we put 38.2% of youth in our county have tried cigarettes. And we get that data from Missouri Student Survey or some other form of surveys maybe in your area, maybe some qualitative data, maybe you did focus groups, whatever it is. We want to make sure that we put that piece in there so that we know that when we started this plan, there was 38.2% of youth that have tried cigarettes. So whenever we get to the end, whenever we're evaluating our plan, did we succeed, did we fail, then we can look back and say, okay, it was 38.2%. What is it now? That makes it measurable. All right, so the next part of our problem is the but why. We know too many youth are smoking cigarettes, but why are too many youth smoking cigarettes? So we want to focus this problem. Before you can address it in your community, you need as much as you can get out of the problem, or you need to learn as much. It's like focusing the lens of a camera. Each time you ask more in-depth questions about the problem, the subject in your camera lens becomes clearer. So, too many youth are smoking cigarettes. Something that you might ask is, where is the problem occurring? Where are they smoking these? Are they smoking them in the park? Are they smoking them in the alley behind some store? What are the high-risk settings that are causing these? Are they doing these because of peer pressure? Are they doing it, at school? Who's affected by it? What's the age group probably? Is it middle schoolers or high schoolers? Usually when you gather your data, those numbers will be in there. And also, generally your community will know some of these answers as well. Okay, so this is an example of the but why. Cigarettes are easy to get in our county. And we got this information based on a focus group that we held. We got people together, we asked them, why are kids smoking? And some of them, maybe they said, well, the liquor store down on the street will sell cigarettes to anybody. They don't card anyone whenever they come in there. I saw a 14-year-old, And that's how you get it. It's that qualitative information that you need in order to identify the but why. Cigarettes are easy to get in our county. Okay, so it's starting to become a little clearer. Too many youth are smoking cigarettes. Why are they smoking cigarettes? Well, because they're easy to get. They're available. We can get them anywhere. We know where to go. We know the guy who's working at the convenience store, whatever the question is, we know how to get them. So we're starting to see the big picture. So now we need to just get a little bit clearer. And that's why what we call the but why here. And this is kind of the final piece of our problem statement that really just makes it local. This is why it's a problem in our county. Okay? So here's an example. So too many youth are smoking cigarettes. There's too easy to get in our county, and the vendors in our county are selling to minors, and we know that because the sheriff's department has run compliance checks, and the vendors in our area keep failing. They're selling them to kids all the time. The police are sending a minor in, and they just sell to them. So they're failing these compliance checks. So now we have it very specific as to what the problem is. We know exactly where it's at. It's nearby. And we can make a plan based on that information. So this is what we got so far. We have a problem. Too many youth are smoking cigarettes. And why? Because cigarettes are easy to get. But why here? Why are cigarettes easy to get here? And it's because the vendors are selling to minors. It's very local, very specific. It's right next door. We know what to do now. Now we can move forward with our plan. Before we get too far, we want to make sure to follow a coherent path here. We want to make sure that we figure out our problem, which we've done, our problem statement now. And from that, we want to figure out, what do we want to do? What do we want to happen from that problem? Do we want to reduce it? What kind of change do we want to make to it? So in order to do that, we got to just think about it and come together. And so we need to set some goals. We want to decide how much we want to affect this. Of course, the first thing you want to say is, we want it to go away. We want 0% of the youth in our county to smoke. And that's the dream, is that no youth are ever smoking in any county. But we have to be realistic. If we set a goal that's impossible to reach, such as 0%, then our volunteers, our stakeholders, all of our members are going to get discouraged very easily. So we want to make sure that we are realistic in our goals, and we want to affect that change over a period of time. So we want to set short-term and intermediate and long-term goals. That way we're making progress, but it's realistic, it's in a certain amount of time. In order to have good goals, we want to follow the SMART method. I'm sure you've heard of this before. We want them to be specific, we want them to be measurable, achievable. Again, that 0% is, we have to think, is that achievable? They have to be relevant to our problem, and we have to give ourselves a time frame. We have to give ourselves a deadline or a length of time that we want to meet this goal. So if we look at what we've done so far, we've got our problem statement at the top. Too many youth are smoking cigarettes. Cigarettes are easy to get, and vendors in our county are selling to minors. Okay, and we went around the strategies and activities because we first have to know what we want to affect. So our short-term goal, we want to reduce the number of failed compliance checks by 5% in 12 months. So we've talked to the sheriff. We know what that measurable amount of compliance checks is, and we want to reduce that by 5% in 12 months. Okay, and then our next goal, our intermediate goal, is we want to decrease the ease of availability by 2% in 18 months. And our short-term goal already affects that, because if they're not selling to minors by 5%, then we've already reduced that. So that goal falls right in line with our short-term goal. And then our long-term goal is to decrease the total number of youth who have tried alcohol and or tried tobacco by 5% in 2 years. So we've given ourselves a nice amount of time. We've kind of set it up for a 12-month, an 18-month, and 2-year time period. You can use any kind of time, but this is just a good example. So now we can go back to the strategies and think about, what do we need to do to reduce the number of failed compliance checks? Or what do we need to do to reduce the number of, or reduce the availability? And so we can form our plan around those goals. So when we do that, we want to talk about strategies. And so the strategy, they focus those efforts even further towards that intermediate and short-term goals and long-term goals. We know what we want to affect, and we can figure out how to affect that. They take advantage of the resources and opportunities that are available, and they respond effectively to resistance and barriers. Efficient use of time and resources, again, because it's planned, it's focused. You know, we don't have everybody scattered around trying to figure out what to do, and it has a greater chance of accomplishing the mission. When we talk about strategies, when we talk about the 7 strategies from the CADCA primer, these are evidence-based, they're proven to work. They're provide information, enhancing skills, modifying access to barriers and opportunities, changing the consequences, so incentives or disincentives for vendors, things like that. We're enhancing services and support, modifying policies and broader systems, and alternative activities. And each one of these is just a little bit different, does something, it affects a different area. So once you've determined which of those strategies you're going to use, then you just plug that into your strategies area, and then you can determine your activities from that strategy. You can't do the activity unless you know what strategy you want to use. So if we was to use an example, let's say providing information, that was one of our first ones. Then we would say, okay, we're going to hand out educational tobacco pamphlets or flyers at the county fair next week or whenever it is. Then you would make an action plan on who's going to do it, who's going to make the flyers, things of that nature. And the activity, so the strategies provide information, the activity is to hand out flyers at the fair. It's pretty straightforward, pretty cut and dry, and that's kind of what you're looking for. Not all of your activities will be quite that easy to accomplish, but it gives you a good idea. So what do we have? We have a logic model. Once you've done all that, you have a full logic model. Now, a good one would have a lot more than just one problem, of course. You know, you would probably address 1 or 2 things. We don't want to get carried away addressing 50 different problems. You don't even want to get probably 5 different problems. Try to stick to 2 or 3 of the bigger problems, affect the change in those, and then you can reassess after some time and decide, okay, we need to apply our resources to other things and try to tackle a new problem. We beat the cigarettes down. Maybe now we need to look at the alcohol or whatever other problems you may have in your area. And you just keep doing, you keep making the logic model and you make the plan. And when you talk about logic models, it sounds real complicated and people kind of get turned away from them, but they're very simple and they're a great tool to have. And that's all I have for you today on planning. Be on the lookout for our next webinar. You can check us out on Facebook. You can message us at moprevention@pfh.org. And we look forward to having you guys. And this recording will be put on our Facebook, so feel free to come back and view it again or show it to others. And we really hope that we were able to help you out here today. Thanks.